Hi everyone, I'm Maggie Lang. I'm the Education and Quality Manager here at St. Mary's Home Care. Today I'm going to discuss developing a nurse residency program, or NRP, in our healthcare system, specifically for a home care division. Please note in your packets for today's presentation, you have a copy of the presentation's transcript, as well as handouts that pertain to certain slides. So for an overview of today's presentation, we are going to discuss the history of nurse residency programs, the advantages of nurse residency programs in our agency, recruiting and retaining nurses using a nurse residency program, a nurse residency program design, our partnerships, academic and stakeholders, and the accreditation process. As we all know, our mission and vision statement is that we are a healthcare system that is committed to improve the health and quality of life for children and families with special needs in New York City and its surrounding boroughs. So the history of nurse residency programs, they have been around since the early 2000s to support new graduate nurses in their roles in practice by providing a supportive educational experience. NRPs are planned comprehensive programs where new graduate nurses or new nurses can acquire the knowledge and skills that they need to deliver safe, quality care that meets the goals of the practice area. Some NRPs can last from either 12 weeks to 1 year of employment. In 2002, the Joint Commission recommended the development of NRPs to address the many issues that new graduate nurses have when transitioning into practice. The American Association of Colleges of Nursing has established models for NRPs that focus on developing new nurses' skills, improving communication with healthcare teams, and developing leadership skills to provide quality care. We need an NRP in our healthcare system to help us with our retention and recruitment of new nurses. We all know that our patients are more acutely ill as they leave the hospital, and new nurses are needed to address the challenges that our patients experience in community settings. NRPs can develop new staff and align with the Institute of Medicine's report that suggests that NRPs should be available to new nurses when they complete school and nurses that are transitioning to a new practice area. NRPs are needed to improve the education of a diverse nursing workforce, and they also have a positive impact on patient care. We want our nurses to practice safely. We want them to be competent and confident in our medically fragile pediatric population. A residency program can provide ongoing support and engagement to improve recruitment and retention in our healthcare organization. There is so much substantial evidence in the literature regarding the outcomes of NRPs that indicate that participation can lead to higher nurse retention rates, decreased nurse turnover, and cost-related savings to a healthcare organization. There are many reasons that new nurses leave their first job. Nurses report that they do not feel supported or confident when they transitioned into a new role after finishing school. An NRP can support nurses' transition to practice and decrease nursing staff turnover, improve patient care, and improve those nurse retention rates. It takes a lot of time to recruit and train new nurses. If a nurse leaves after orientation is finished, it may mean that he or she was not set up to be successful from the beginning. In a study from 2006 to 2016, funded by the Robert Wood Johnson Foundation, it was revealed that almost 20% of RNs leave their first job within the first year, and more than 26% leave their job within the first 2 years. Nurse retention is something that is one of the largest issues in the United States today and is significant across all areas of healthcare. The Affordable Care Act has reinforced the current trend of providing care in the community and public health settings. New care delivery models will change and influence health outcomes in underserved populations and implement community solutions to improve healthcare at home. But nurses are needed now to influence these new care delivery models and improve health outcomes in our communities. In New York State, almost half of all RNs worked in a hospital-based or acute care setting, as compared to only 28% who worked in community-based settings that includes home health. An NRP can address the high rate of turnover that community settings and home health are experiencing, and also provide the work-related training that is specific to underserved areas and diverse populations of our state. Home care nurses report that working conditions, job satisfaction, support, and salary are factors related to their decision to stay or leave a home care agency. We are experiencing a constant nurse turnover in our agency. This can have a negative impact on our finances and the quality of care our patients are receiving. Since September 2017, in our agency, the calculated percentage of nurse turnover is substantial at 50%. We hired 16 nurses, and we were only able to retain 8 of those nurses after 6 months of employment. The cost to replace a new nurse is $97,500. In our facility, the cost of the one-year turnover is a staggering $780,000 to replace those 8 nurses that were trained and then left. I project a 25% decrease after the initiation of an NRP in our agency in the program's first year. That is a net savings of $195,000. There is a limited pool of nurses with experience that can fulfill the job requirements and be successful in the care of children who are medically fragile and have special needs. Patients' care may be negatively impacted by a nurse who has not developed a critical thinking ability or a knowledge base related to our very specific patient population. Recruiting new graduates and nurses that are transitioning to a new practice area are options that should be explored more earnestly. A nurse residency program that is tailored for new graduate nurses will assist them with their transition from their academic program to a competent and autonomous role. An NRP that includes a comprehensive year-long educational support and training and objectives that are specific to home health can then develop nurses and train them specifically for a role as a home care nurse. The training program can then be altered and specific to a new nurse's educational goals. In your handouts for this presentation is a copy of a prospective template and those learning resources that are needed for our NRP. A home care residency program that hires new nurses can then require 1 year of employment post-residency program completion, which is comparable to the hospital nurse residency program requirements. Our NRP program design can include a strong curriculum that includes team building strategies, collaboration exercises, cultural competency exercises, management of chronic disease syndromes and congenital disorders, strategies to prevent hospitalizations, and competencies to promote leadership skills. NRPs can be structured over a specific time period, such as 1 year for new graduates or 6 months for nurses transitioning to a new practice area. There are several essential goals that should be identified first during the development of an NRP so that the expectations of the program are met and the program can be sustained in our home health agency. We want to decrease nursing turnover and increase retention of our staff. We want to improve our patient outcomes. We want to improve nurse competency and leadership skills. We want to encourage professional development for our nursing staff. We would like to partner with schools of nursing. We want to anticipate a financial and cost savings from this program. We would like to have employee and preceptor satisfaction with the program. And ultimately, we would like to gain accreditation of the program. During the development of a nurse residency program, a program evaluation tool should also be developed. Evaluating a program's effectiveness is critical to continued leadership support for the program. Some questions that might be included in the evaluation are, did the program meet the outcomes that it identified during the planning and implementation stage? Are the new employees performing as professionals in the field? Do patients and families report an increase in satisfaction on their surveys with our agency? Evaluations can be given in the form of surveys to new staff, to families, to the education manager, and to the preceptors to gain feedback and insight on program improvements. Positive program evaluations can help the agency to celebrate the success of the program and the goals of nurse recruitment and retention. An NRP should have a hierarchy of personnel on a team that develops, implements, monitors, and evaluates the program. And they're listed here. These positions should foster the achievement of the mission, goals, and expected program outcomes. A well-developed NRP will have defined roles of its leaders, educators, and faculty within the program. Having a strong team that can interact, develop ideas, and has the same goals can add to the success of our NRP. Please refer to handout number 3 for further descriptions of these different positions and requirements for our staff. A well-designed NRP should include learning resources that are built into learning modules throughout the program. Learning modules and resources can support the competencies that are needed for new nurses to practice safely and increase their clinical knowledge in a new area of practice. The team should identify the main competencies that new nurses need and then develop each of these modules. The modules are then divided into categories that can focus on the learning outcomes and goals that are anticipated during the NRP. Please refer to handout number 2 for a list of the modules and further explanation of the learning resources that will be included in the NRP. A partnership with an academic institution is an essential connection that can be used to strengthen nursing practice and develop systems for nurses to achieve their educational and career goals. Developing a relationship with an academic entity has value for both institutions. Collaboration, development, implementation, and evaluation of residency programs can be accomplished between the two partners. New nurses can transition from institutes of higher education seamlessly into a specific practice area, such as home health, when there's an academic partnership in place that assists during the development of an NRP. Cost is possibly the greatest barrier that an agency must overcome when initiating a successful NRP. Costs related to the program include hiring nurse preceptors and training them to facilitate the transition to practice for new nurses, and purchasing and creating educational materials specific to new nurses' learning needs. Carefully selecting a preceptor and creating a formal development program for their success is a necessity for any NRP. Options for funding the cost of the program should be explored. Grants, government agencies, philanthropic gifts, and partnering with the foundation in our healthcare system are some options that may be available to offset the initial cost of starting the program. Finding avenues of funding is an important first step during the initial development phase of an NRP. Without funding for a program, it is likely that the program will be unsuccessful. The accreditation process should begin during program design so that criteria and standards are built into the program. After program initiation, a gap analysis should be completed to identify gaps where the program does not clearly meet the standards and criteria of the accrediting agency that will ultimately evaluate the program. The Commission on Collegiate Nursing Education, the Accreditation Commission for Education and Nursing, and the American Nurse Credentialing Center are all organizations that accredit NRPs. Most hospital systems in New York have their own NRPs that are not accredited by any of these organizations. In New York State and surrounding states, there are only a few home health agencies that have received accreditation for their residency programs. These programs are the gold standard that can be used as a guideline when developing an NRP program for our organization. Key stakeholders, that's you. Obtaining widespread support of this NRP is something that is essential in our healthcare system and must involve leadership throughout all aspects of the program's development, implementation, and evaluation. We need your buy-in for this program to be successful. I would like to thank everybody for attending this presentation today, and I welcome your questions and comments. Thank you.